Thanks very much. I became a father a month ago, but it's a bit too early to give already fatherly advice. I read through all the documents, and today we were asked not to provide any slides, so I didn't provide any slides. We were asked to basically comment on a couple of questions which I think are relevant. My name is Thierry Troosters, as was already said. I'm a physiotherapist. I work in the Department of Rehabilitation Sciences at our university. And I lead from a scientific perspective, I lead the proactive project, which you heard already about from Michel. The first question that we were asked is, based on your experience, what advice would you give to someone preparing an expression of interest? Well, that's a difficult question. I could only say what we did. What we did first was that we explored within the FPA members that we knew whether what we wanted to propose was something that was going in the line of what they were expecting. And we did that up front so that we knew that what we were actually going to do, which was to develop a patient-reported outcome, we wanted to do that around physical activity, whether this was something that was in their interest or not. You could do many things. You could do exacerbations, you could do other things. So we wanted to forecheck and see whether physical activity would be something that would be appealing to them even before we started preparing our expression of interest. Then I think it's very important that you sort of prepare a core group of people who want to work with you. Just few of them. We had about 4 or 5 people that met for the first time in Athens when it was still a good place to meet there. And so we met there and we said, okay, are we going to do this? Yes. And it was just a small group of people that wanted to work on this project. I think next is that we try to be comprehensive in our approach, which means that we tackled the problem from all possible angles, meeting the objectives that were outlined in the call topic. But also we were not too much thinking out of the box, because we felt that perhaps the FPA companies would not be too comfortable when it would be something completely weird or strange. So we stayed sort of within mainstream, but approached it from a number of interesting new angles, which is, for example, what we did with our patient-reported outcome tool. We wanted to add a physical activity monitor, and that's new to the field of patient-reported outcome tools, but on the other hand, it's not so crazy that FPA members would be set off by the idea of having a monitor included in a patient-reported outcome tool. So it was on solid ground, but yet innovative. Then I think it's important to be creative within your consortium and try to involve all stakeholders. And I've been talking with other people who, in the same call topic, submitted a proposal. And I think they fell short in making sure that they included patient organizations, scientific organizations. So it wasn't just academic institutes, but we really looked a bit broader than that, and sort of we're thinking about who could be all the stakeholders. And so we felt that patients were important stakeholders if you're developing a patient-reported outcome, which was the question, that scientific organizations such as the European Respiratory Society would be important to be involved, because if you want to disseminate throughout Europe your tool, you need an organization that can allow you to speak in their conferences and so on. So we also included the European Respiratory Society as a partner in this. We also wanted to include the regulatory authorities. At the time, they couldn't be a formal partner, but we felt it was important to include them in the proposal. And so since they couldn't be, EMA couldn't be a partner at that time, but we could have them in our advisory board. So we created an external advisory board in which we then put all the other stakeholders that could not be a formal partner. And that was sort of felt as being a clever move, I guess. And then the last point I wanted to mention is, if you want to prepare an expression of interest, please first discuss this with your institution. I did this in Katholieke Universiteit of Leuven, where we do have an EU office, and we had lengthy discussions whether this was a good thing to do at this stage in my career, whether it was good, bad for the institution, for me personally, how did I get the 25% additional funding that you need, things like that. Small things that need to be discussed within, I think, the one who is going to make the application, but also in the partner institutes. Make sure that you discuss this with your legal entities, with your financial departments before you step into this big endeavor. The next question that we were asked was, how do we look for partners? And I was very happy to see that the IMI now has their own tool which can help you finding partners. And I'm sure I haven't used it because it wasn't existing when we did our proposal, but I'm sure this might be helpful, particularly if you want to be broad in your approach and make sure that you get all the stakeholders. That might be a brilliant asset. What we did was we looked for a core set of academic friends. We were just a small club of people. We have a relatively small consortium with only 11 IMI-funded parties and about 8 FPA members. So it's a quite small consortium. And it's basically built around a set of academic friends. And we sort of had a team. We were the next generation of people doing research in pulmonary disease. And I think that has also had some appeal. We put that with so many words in the application that we were all in our 40s, the next generation of researchers, and this was sort of what drove us to work together. We were also a very multidisciplinary team, not just doctors putting together or scientists putting together a proposal, but I'm myself a physiotherapist, and we have pneumologists, we have nurses, we have a very multidisciplinary team of people coming from all over Europe. We also, from the beginning, from the get-go, wanted to include patient organizations. We have 2, one from the UK, which is the British Lung Foundation, and one from Holland, the Dutch Asthma Foundation, and they're very strong patient organizations to be a partner in our project. We also looked for professional and scientific societies to be a partner, and we made sure that we had a good scatter throughout Europe. So we have Belgium, we have the UK, we have Holland, we have Greece as core partners, Spain and Switzerland. And then we also needed to be complementary to the FPA members. So we first explored what do we think we can get from FPA. We will not look for partners who can give us this exact same thing, but we'll look for other partners that are very complementary to the expertise that we can get from our FPA members. For example, we do have somebody who will do data management, but not the exact implementation of that, because we expected this to come from the FPA members, which was the case in the end. The last question was, what have been the benefits to you of participating in this project? Well, I think I explored, or I found a new way of doing science, a very collaborative way of doing science, and I mean, I had never worked in an FPA company, and probably now I don't want to work in an FPA company anymore, but it's really a new way to do, a different way of doing science, and it's only by being involved in these projects that you can see how they are working, how one and one is put together on their side, and you also understand the synergy and the complementarities of both sides. So I think it's great. It's a bit science on the safe side, as we call it, because FPA members, they are a little bit more conservative, I would say. But still, I think it's a great way of doing studies. It gave us a unique insight in how the pharma industry worked. And I did get some interesting new contacts from the FPA members, and I think that counts for most of the academic partners, as we are all relatively young scientists when we started with our project. I mean, through our contacts with the FPA members, I'm sure that we had some interesting spin-offs. We did get very high visibility, and it's been, I must say, extremely useful for my own personal career. I'm not shy to mention this, but being the lead in such a project for a scientist is a big thing, and you are being seen. And I think that might also be a reason to apply for this type of funding. And scientifically, I think we've sort of explored a new horizon, doing research in a multi-center context with proper external data management. Typically, if we do things as scientists, we're sort of working with our own little database, and now all this goes through these bigger databases, and you get more solid data and more spin-off, and the first papers are coming out now, and actually it will be really much more papers than what we typically get from our projects. And lastly, what I learned from this project is that we got also in touch with the regulators, and so we understood better as academic scientists who normally don't have much to do with regulatory authorities. It was also enlightening for us to see how the European Medicines Agency work, how they judge on developments, which typically we don't sort of feed back to the regulators. We do a development and then we wait until somebody brings it to the regulators. Now we're doing that ourselves, and I think for an academic that has been really an interesting experience. Preparing these dossiers is sometimes a bit boring, but on the other hand you sort of get to know how things work in Europe, and that for me personally has been a great joy. Thank you.